Good afternoon, everyone. We're just going to get started in a couple minutes to allow everyone to sign into Zoom and get set up. All right, I think we will get started. So good afternoon. Thank you for joining our latest webinar in the Caring for the Caregiver series. Today's webinar will be focused on home care services available to family caregivers. My name is Dana Beguerie, and with me is Shannon Turner. We are both program coordinators with the Home Care Unit at the Executive Office of Elder Affairs. The purpose of the Caregiver series is to provide simple tips, practical solutions, and information on community resources to support family caregivers throughout Massachusetts. Through the agenda today, we're going to start with an overview of the home care program. We'll talk about the Mass Options program, which will connect you to the home care program, other home care services available to Mass Health consumers, and then at the end, we will have a Q&A. So don't forget to put your questions in the chat or in the Q&A feature. Before we move into our official program, I wanted to start with some quick housekeeping and tech logistics. So you will see closed captions at the bottom of your screen, which can be disabled at any time. And also every webinar is recorded and posted on our Executive Office of Elder Affairs YouTube page, which my colleague Molly will put a link to the chat. So to start, the mission of the Executive Office of Elder Affairs, or EOEA, is to ensure all older people and their caregivers have opportunities to thrive in the communities of their choice. EOEA oversees 24 aging service access points, which are not-for-profit agencies that are contracted to administer programs and services funded by the Executive Office of Elder Affairs. You can reach these agencies by contacting Mass Options or going on their website or the mass.gov location tracker. And we will show you how to find this information through Mass Options a little later on. So services that are offered through aging service access points, the one we're going to be focusing on today is the home care program. We will also touch upon a few others. So just wanted to give you a general overview. We have information and referral, which you can contact for information on community resources, as well as referrals to other ASAP programs and external programs. We have SHINE, which stands for the Serving the Health Insurance Needs of Everyone for Medicare Counseling. We have a nutrition program for nutrition coordination, home delivered meals, education. The Options Counseling Program is available to anyone over the age of 18, and that will, excuse me, that program also helps connect people to community resources for people that might need a little bit more hands-on assistance. We have the Family Caregiver Support Program. And then there's also protective services, which serves as our elder at risk. If an older adult is experiencing financial exploitation or emotional or verbal or physical abuse, there is a hotline that you can call to report that, which then is investigated by the ASAP. So to focus on the home care program functions, we have care management, which is the home care program eligibility and assessment. So each person who applies for home care services does go through a process to determine their eligibility, the home care program enrollment, and advocacy and education. And then for care and support coordination, there's authorization and purchase of home care services, coordination of comprehensive community care, management of the procured provider network, which includes provider vetting and monitoring and negotiation of rates and services. So if you were looking at putting services in the home and private paying, you'd be doing all that legwork yourself. What the home care program does is they find those vendors that can provide those services in the home and they coordinate that care. So the main functions of an ASAP are to provide support regardless of home care program eligibility, assist people regardless of income. Many of our programs are free. and provide resource and community service information at no cost, which is our big free program. And now I will turn it over to Shannon, who will talk about the home care program.
Thank you so much, Shannon. Just confirming you can hear me?
Yes, I can hear you.
Great, thanks so much. So what I'm going to talk about is the home care program, which is a function that happens at the Aging Service Access Point, the ASAPs that Dana just talked about. So the home care program, our mission is to provide care management and in-home support services to help older adults, people with disabilities, and people with Alzheimer's disease or related dementia to successfully age in place within Massachusetts. And then we have services that are available to these individuals based on their assessed needs by the staff at the ASAP. And so what are the benefits of home care? So the benefits of home care is we have case management, which is they manage their care plans, which is the assessed need. They engage with the providers that Dana had mentioned to talk about things like scheduling, what's important to the consumer. And they also have a connection with other community resources and partners that are available to you within the area in which you live. So a little bit more about the provider network. It's an accepted vendor by EOEA. And what does that mean? It means that it meets programmatic standards and requirements that we have set forth for that particular entity for the providers. And they are also monitored and audited on a regular basis by the Aging Service Access Point to ensure that they continue to meet the compliance requirements that have been set forth by EOEA standards. Part of that includes the service rates, which those are negotiated rates based on all ASAP practices and businesses. It is less expensive than private pay because it is a larger scale negotiated rate. And the state does set certain rates for mass health services. Another benefit of home care is advocacy, which is a large part of the ASAP network. And they engage in advocacy for services and providers versus, as Dana had mentioned, trying to look for those things on your own. And also, it's the benefit of having an advocate to address those concerns, potentially maybe within entities that are within your community, and how to best get that support that you're looking for. And so we do have potentially some consumers that have a higher percent copayment. And the benefit of that is you still receive the home care enrollment and all the benefits that I had just mentioned. There's also no minimum service plan, so you don't have to accept a certain amount of hours within a certain amount of day to be able to meet the needs that you're looking for. And then again, that care coordination is done by the care managers to coordinate those services and resources that you're looking for to provide the best support for you. And then what does eligibility look like if you were looking for services within the home care program? So we do have age and residence eligibility. So for age, you have to be 60 years of age or above, or you can be under age 60 with a diagnosis of Alzheimer's disease or related dementia disorder. And then for residency, you do have to be a resident of Massachusetts. And then you also do need to be either living within the community or transitioning into the community. And what does that mean? That means if you're or a loved one is living in an assisted living or a skilled nursing residence, and then wants to transition into a home or an apartment, they would be eligible as well if part of the plan is to transition into the community. So just to provide a little more understanding of what that means. So we also have an income and cost share for home care. So anyone that any income can come in and is eligible for home care. And we do have a cost share contribution, which is based on income as well as mass health. So the cost share is adjusted annually based on the cost of living increase that is set by the federal government. We do have some exceptions to income. We have some VA benefits that are slated for specifically for services, pooled trust. Those are not counted as income. And we also offer co-payment adjustments for individuals who might have large medical expenses. If they are looking for services, they could certainly receive a co-payment adjustment. So the co-payment is not a barrier to someone accessing services. So what does this cost share look like? There's a couple of different components, and I'll go through those. There is a voluntary donation, and it's a fixed monthly max co-payment. The range is from $10 to $199, and it's not to exceed the actual cost of the services. So you'll never pay more than what the actual cost of the service plan that you have in place. And then also there's, like I mentioned, that those are percentage-based monthly copayment dependent on income and your qualifying services. So those are the three categories. So for the individuals with the voluntary donation, those are for individuals whose annual income is below $13,783, or for a couple whose annual income is below $18,561. So they would fall into the voluntary donation. And then for the fixed monthly copayment bucket, if you will, in the middle here, that's based on a sliding scale for individuals whose annual income is $13,784, going all the way up to $30,965. And then for anyone who is a couple, for their annual income is $18,562, all the way up to $43,814. And then for the percentage-based services, again, that's based on a sliding scale based on your income. For anyone whose annual income is $30,966 or above, or for a couple whose annual income is $43,814 or above. Now, I will say that there is a lot of numbers. And so when we talk about what happens when you call and make a referral for services, the ASAP will be able to provide these for you. So it's not something that you need to, have written down or have be able to remember, when you call. This is something that they already have available, that they can talk through that with you. And then I will just mention that for anyone who is looking to apply for a mass health and then potentially receive services with a mass health benefit, it's for members whose income is at or below 300% of the federal benefit rate. And so that the current numbers for 2023 are $2,742 a month. And again, that is a mass health numbers. And so mass health would determine eligibility based on those numbers. But anyone who does have mass health, they would not be assessed a copayment for home care services. And so these are some examples of the home care program care plans. So the care plans are developed and implemented based on the consumer's unique and specific needs. And so these are the home care programs, and they're broken up into sort of what is an example of what these services would look like for you. For if you had called and looking for services. So anyone who is in home care basic non-waiver or home care over income or respite over income, it's really that basic, that first level of care needs. And so what would that care plan look like? That's an example of potentially, we have a care plan number one that would be home delivered meals 5 days a week. And then maybe homemaking or personal care 2 to 3 days a week. Another example within this basic or sort of first tier care plan would look like home delivered meals, maybe 3 days a week, a personal emergency response system, which is a way to access help if someone lives alone, and then potentially homemaking, for like an hour and a half or times a week to support what those needs are. So this is just really highlighting that there can be different care plans based on the assessed needs of the individual. And then we have the Enhanced Community Options Program, and that is for individuals who have a nursing facility level of care needs, means they just need a little more supports in the home. And so what would that care plan look like? That would look like, could be home delivered meals 5 times a week. Also a personal emergency response system. And then homemaking or personal care 2 to 3 days a week. So as you can see, from the first bucket of that basic level care plan, it is a little more enhanced, a little more support. And then for this care plan example number 2, it could be adult day health 1 time a week. Again, just homemaking about an hour and a half a week. And then again, that personal emergency response system. So there can be some variations, again, based on what your needs are. And then this third category is for individuals who are in the Frail Elder Waiver. And those are for individuals who are eligible for mass health. And so these individuals, again, are nursing facility level of care. And then they have these 2 types of programs based on the needs. So what could these care plans look like? So for home care basic waiver, an example care plan could be, again, that home delivered meal service 5 times a week, some homemaking and PC a couple days a week, and some informal supports. But they don't have a lot of formal support needs. And then for someone who's in that choices category, which is higher, they have more needs for that formal support. They need services to meet those unmet needs in the home, and then they could potentially require up to 24/7 care. So those are really higher need individuals. And again, to reiterate, the service plans, they're based on the program, and then the care plans are based on the assessed need by the care manager at the agency. So for the home care program, what does care planning and care management look like? So there's an initial assessment. So there's an initial on-site assessment. And so to determine the consumer's eligibility. And so a care manager would come out and talk to the consumer, talk to the caregiver, and talk about what the needs are and what service plan would best fit their needs for their supports that they're looking for. So that's that assessment that they provide to identify what those supports are in place and what those unmet needs are. So that would really happen at the initial assessment when the person comes out. And then they do have an ongoing assessment. So those are every 6 months. And again, it's a reassessment of what those identified needs are, what the supports are in place, if there's any changes. Again, it would be a conversation with the consumer and the caregiver. and how things were going, if there was any changes in medication, any hospital stays, things like that. And then potentially based on that information, if there was any changes that would need to be made for the care plan, that they would do that review again with the consumer and the caregiver. And then there's the annual assessment, which is part of that every 6-month on-site assessment. And again, they review the care plan and the service plan, make sure that things are going well, that services are going well, that the consumer and the caregiver feel supported with the care plan and the services that are currently in place. And then for those individuals that have that clinical eligibility, which is that nursing facility level of care, for either anyone who's in the waiver or that enhanced community option program, or ECOP for short, those are assessed by a nurse who would come out and do that assessment as well, in addition to the care manager. And so these are, this list is our home care services. And so I will go through just to give you an understanding of what those could look like if you were looking for some supports for you or for a loved one. So we have Adult Day Health, and that is a service where somebody would go to a day, a program where there would be, they would have coordinators there, they would have nurses there, and they would do programs for the individual, and they would be there for the day. That typically involves transportation to and from the individual's home. And then we have Alzheimer's and dementia coaching, and that would be a support for the consumer as well as the caregiver that would talk through some of the identification of Alzheimer's, education, conversations around what to expect maybe in the future, how to support anything that's happening within the home that the caregiver or the consumer identifies. And then they would really be the support for the family within that setting. And then behavioral health services, if someone wanted support for any mental health or substance use, they would be able to access support through that. Chore is a service where if someone needed like heavier cleaning, cleaning like ceiling fans or things like that, sometimes chores used for potentially if there's any instance into the home where they need like larger things like moved and cleaned, that would be part of the chore service. Companion service is a service where somebody would come out and sit with the consumer for a couple of hours if the caregiver had to go somewhere, and they wouldn't do any cleaning or personal care or bathing or dressing or things like that. They would just come and they would sit and they would just be company for the consumer while the caregiver had to go out. That complex care training and oversight, that is nursing. That is a nursing support. If someone needed support with nursing, maybe medication management, then they can access some support through that. Electronic comfort pets is it is a pet that is electronic, it's not real, so you don't need to feed it or walk it, but it does respond to the individual. There's currently dogs and cats and also birds. So the bird does chirp, the cat purrs and the dog does bark, and they do move. So that is available for someone who maybe had a pet and is maybe not able to care for one. So they could access that support to provide some comfort and companionship in that instance. And then environmental accessibility adaptations, if someone needed some change in the bathroom to support, some sort of bathing need, that would be available as well. And then evidence-based education programs, those are things like Savvy Caregiver, and there's a large list that we certainly can provide that are available under evidence-based. There's support programs around chronic care management, support for caregivers, support for individuals that have diabetes. Those are available as well. Goal engagement program is a program for individuals that are in the home, and maybe there's some identified needs to support the individual better, that may include some home repairs. So it would include some home repairs, support with a nurse to make sure that all the services are best supporting the consumer, and then as well as maybe a physical therapist or an occupational therapist to support what those changes are, maybe if it's like a raised railing, things like that. So those individuals would all be part of this goal engagement for the goal of the consumer to be able to remain in the home and maybe make some adjustments in the home for that to happen. Grocery shopping and delivery services. Someone could be able to grocery shop for the consumer and then bring the groceries home and put them away, or a delivery service. And then home-based wandering response system, that is similar to your your personal response system for someone who is home and wants to have some support around that. Home delivered meals, which is a meal service that would be delivered by a certified driver from the ASAP, and would come and bring in and see the actual person and then give them the meal. Delivery of prepackaged medication, if someone needs that service and needs their medication in those individual pill packs, that's available. Homemaking, to do some laundry and cleaning around the home. Home health aid, which would support those personal care, those bathing, those dressing needs. Home safety evaluations. Again, that's the occupational therapy that would do the assessment of potentially what would the needs be. If, for example, there was a need within the bathroom to support, a safe bathing environment, the occupational therapist would be able to look at what was actually what the person's needs were, and then also in conjunction with what the situation in the bathroom looks like. Is it a raised seat? Is it a grab bar? And how can those best support the consumer? Laundry services, it could be a laundry service that gets sent out and then brought back on a regular basis, depending on what the needs are of the consumer. Again, that medication dispensing system, that would be another medication support, but it would be within the home. And then it would dispense the medication within a programmed time frame based on the consumer's needs. Nutrition assessment and counseling, that could be if someone has maybe a recent diagnosis and they have maybe new nutritional needs, they could access support around that, some education around that. Someone could come and provide support with that. Orientation and mobility, again, those supports within the home as far as making sure that what the person has as far as maybe supports, so maybe like a walker or a cane or whatnot, and how to be able to support those within the home. Peer support is a network of individuals that support older adults with mental health challenges, and they are individuals who are trained, and then they provide support for individuals, and so it's a peer support, so they have lived experience for what they're providing support for the individual. Personal care, again, that's bathing and dressing within the home. Again, that PERS, that personal emergency response system, is a system within the home. If someone is home alone, they have access to press a button, and they can wear it in different ways to be able to access emergency support for them. Respite is for the caregiver to provide that respite support for the caregiver. So any services can really be utilized to offer respite for any supports that the caregiver indicates that you would need for respite could be utilized within that. Supportive Day program is a program that is similar to Adult Day Health, but there's not the medical component to it. So it's sometimes they're at a council on aging, and then there's it's for a few hours, and they do some engagement program with individuals. Supportive home care aid, it's just more enhanced support for someone who needs assistance with that bathing and dressing. Transportation for medical appointments, if someone needs transportation to get to a medical appointment, the ASAP would be able to help with that. Transitional assistance and vision rehabilitation. So vision rehabilitation is typically done for individuals who maybe have a diagnosis of low vision, and someone would come out and provide some tools or supports around making some changes within the home, some modifications for the individual to be able to do things more within the home based on from a lens of vision changes and vision needs. And again, just all these care plans, they're based on the consumer's assessed need. And so now that we know all of what the services are available for individuals who call the ASAP for services within the home care program, what does that look like? So if you're an applicant and so we have an applicant who the daughter called and called the ASAP requesting assistance with some bathing and homemaking. And then the daughter said, oh, the medical conditions are COPD, shortness of breath, and uses oxygen 24/7. And so the daughter says that she provides assistance with shopping and meal prep, doesn't feel overwhelmed, but does report, that she's unable to provide regular assistance with homemaking. Maybe she, goes to work on a regular basis and is just not able to keep up with that on a regular basis. So what would happen? So the ASAP care manager would go to the home and do that assessment that we talked about, and then would determine that the individual is found eligible for home care services. And then those services would be that the home care program would provide the homemaker to assist with the housework as well as the laundry within the home, because the laundry is in the home, as well as a personal care worker to assist with that bathing and dressing for the consumer. So this is just an example of what it would look like if you as a caregiver made a phone call to the ASAP and a look to see of what the steps would be between the phone call and then what the services would look like. So I'm going to turn it back over to Dana to talk about how to get started with home care.
Thank you, Shannon. Just confirming you can hear me.
Yes, I can hear you. Thank you.
Okay, great. Thank you. So how do I get started with the home care program? Try to push my PowerPoint ahead. Okay, so there are two ways to get in touch with your ASAP. You can contact them through the Mass Options program, which I'm about to go over, or you already have their phone number and you can contact the ASAP directly to put in a referral or ask any questions that you might have about the home care program or other programs available. So for Mass Options, there is a website, massoptions.org. You can also use their toll-free number, 800-243-4636. They are available Monday through Friday from 9 a.m. to 5 p.m., and there are 180 languages available. The Mass Options is great if you're not sure which ASAP covers your area, or maybe you have another family member or a friend in a different city or town and you want to get them connected as well. You can give them the information for Mass Options, or you can also find their ASAP for them. So there's 4 easy ways to reach Mass Options. You can call, you can use the online chat feature, which is also available Monday through Friday from 9 to 5. You can click Get a Referral, which I'll show you in just a moment, or you can submit any questions that you have to Mass Options directly, and they'll get back in touch with you within 1 business day. So if you use the Get a Referral feature on the Mass Options website, you just click on that little link there that says Get a Referral. The screen will pop up. It says, which agency would you like to connect with? There's quite a few to choose from, but in order to access home care services, you want to choose the Aging Service Access Point ASAP option. And then you can select the city or town from the drop-down list below. So here we have Abington. And once we click the submit button, the referral results will pop up. It gives you the agency name, which for Abington is Old Colony Elder Services, their address in Brockton, their phone and fax to reach them directly, their email address, as well as their website. I would suggest calling the ASAP directly. You'll get in touch with the person that you need to immediately, and they'll be able to answer any questions that you have. Otherwise, you may have to wait a little bit for a response. So I suggest calling directly. All right, so I'm going to turn it back over to Shannon now to talk about what happens when you call Mass Options or your ASAP.
Thanks so much, Dana. So what happens when I call either Mass Options or the ASAP? So if you call Mass Options, you will get connected directly to the ASAP, or you can just call the ASAP directly. So for the slides that Dana had put up for Mass Options, you can put any city or town. There's a whole list, so you don't have to type it in. All you have to do is scroll through. They are listed alphabetically, and whatever agency covers your area, that's what agency comes up. So what you can do is you can call, you can send an email. You can also click on, every ASAP has a website. So you can click on their website to get a little more information about them if you wanted to do some research before you called. So all of that is available when you click that submit for Mass Option for any community within the Commonwealth, within Massachusetts. So that's available to you as well. So if you've done all of that and you're going to make the referral, you still want supports within the home care program, and you call the ASAP directly, or you go through Mass Options, either way, you get directly to the ASAP receptionist, who will then transfer you to information and referral department. So they'll say, hold on, I'm going to transfer you to the information and referral department. And then what happens is information and referral specialist will then take the information from you for the home care referral, and then they will send it to home care. So that is the trajectory of what happens from a phone call to the ASAP to home care. And so when you get to the information referral department or intake, because they're taking in information, what information might you need to make that home care referral if you're calling for supports for a loved one? It would be helpful to have this information. I will just say that whatever information you have, the information and referral specialist will take that information and then we'll process the referral. So if you don't have all of this, if you only have parts of this, that is okay. You can still process the referral. And just letting you know that any information that is needed can also be gathered at a later time within the home care referral process as well. And so what is that information? So the name, address, and phone number of the consumer that you're calling about, the individual that may need some support in the home. If you are the caregiver and you're calling, what your needs are, what your needs are, what supports are you looking for? That would be helpful as well. If you have information about their medical conditions, you can provide that as well. Any in-home care needs. If you identify someone needs some assistance with some homemaking, some vacuuming, some laundry within the home. If someone needs assistance with transportation to a medical appointment. If someone needs assistance with some bathing and dressing needs. So whatever those needs are, you can let them know that as well. Also, any income information, if you have that, again, if you don't, that can be gathered at a later time. And then any other information that you think might be helpful, if someone has a pet, you could provide that information. If someone lives on a second floor and maybe needs to be buzzed in, you could provide that information. So thinking about those things, that would be an example of like any other information that would be helpful. If you as the caregiver don't live with this individual, but you want it to be there, you could certainly let them know that as well. So anything that you think would be the most helpful for both of you to access supports, you could provide that to information and referral when you make that call. And then what other supports can information referral provide in addition to home care? So the ASAP could have resources to other providers that they could give you information on that could make home visits, potentially maybe someone who in podiatry who maybe does home visits, things of that nature. They would have that because that would be a list of individuals that they have that provide supports within their community. So they have a whole list of resources that they could provide you with. Any senior living advisors, any information about housing options within your community or other communities, they would be able to provide you information about that. Any public benefits, any health insurance questions that you could have, anything if you were looking for fuel assistance, especially we had that cold snap recently. If it was identified that was a need, you could certainly call the ASAP and ask about that. Any SNAP benefits, which is supports around food insecurity. So if you're looking for support around that, they could provide you information about how to access SNAP benefits or food stamps. And then referrals, they could do an internal referral again. If after talking, you decided you want home care, they could do that referral for home care, nutrition, which is that home delivered meals or a nutrition assessment, and then also family caregiver support. If you just wanted to talk to a family caregiver specialist and talk about sort of some support options and what that could look like, you could also receive that referral within the ASAP as well. And then again, after having all those conversations, you still can move a referral to home care if after that conversation leads to still looking for supports within the home. And then also it could be a referral for the personal care attendant program. adult family caregiver or senior care options, which those are all mass health programs that could be available to someone if they are receiving mass health. And so again, all information and consultations provided by the ASAP with the information referral staff are free. So if you're looking for supports, if you have questions and you're thinking about what supports you're looking for or what needs you have in the home, you can certainly reach out to the ASAP and they can provide you some additional information for you. And then I think we're going to take some questions. I think Molly, I see some questions coming through in the chat.
Hi, everyone. Molly Evans here from the Executive Office of Elder Affairs. And thank you to these wonderful speakers. I learned so much about home care. So yes, Shannon's right. We got lots of questions in the chat and the Q&A from you all. So thank you for submitting your questions. So we can just dive in and I'll ask the questions that we got, and whoever wants to answer can speak up. So the first was, what is the time frame for receiving an evaluation?
I'm guessing that's from the time that the home care referral is made until somebody comes out to the home to do the assessment. And from the time that the home care referral is received from the home care department, they reach out usually within 3 business days and schedule within the next 5 days to come out and do the assessment in the home. There is a period of time after where the case is conferenced with other members of the home care team to just approve the suggested services. But if you're looking for home delivered meals, that is something that can start the day after the assessment. So for home delivered meals, there's no wait. I don't know if Shannon has anything she'd like to add.
Yeah, thanks so much, Dana. Yeah, I would just say that there are certain supports that can start at an earlier time frame than others, depending on what those supports are. And then I would just also add, if you had a time frame where maybe you as a caregiver wanted to schedule the appointment so you could be there with your care recipients, you can let them know that, oh, my time frame isn't going to be until next week, or so you can let them know that you maybe need a shift in that time frame as well.
Great. So they'll work with you to make the timeline work. That's great. Next question we got is, what is the annual income limit you mentioned? Or no, is the annual income limit calculated after taxes?
So it's the gross annual income, and within our regulatory requirements, we do have a whole list of what those are. And I would just say, you can just, you don't have to know to the penny. I would just say, if you have just an estimate of what you think someone's, for example, pension is, or what their Social Security is, you can just mention that, and then you can still move through the process. So I would say we have things down to the penny for regulatory requirements, but for you as a caregiver, you can just sort of give a brief summation of what you have, and that would be sufficient.
Great. And sort of piggybacking on that, Shannon, if I as a caregiver don't necessarily have all of the information on that slide that you presented, can I still call INR, call Mass Options, and get the process started?
Yes, you can absolutely get the process started, and you can gather the information, or you can let them know that you're still waiting for information. That happens quite often. sometimes people just don't have it or they're looking for it. That's certainly fine. You can let them know that you just don't have it at that time, but you still want to continue with the referral process while you're in that stage of searching for things or looking for things. So certainly start the process when I would say if you are feeling like you're looking for some support, certainly start the process and don't let the income be a barrier or holds up any referral.
Great. Next question we got, what is the difference between informal and formal support?
So informal supports are family members, friends, neighbors, people who can provide care and support directly. Formal supports are like our vendored services. So the home health aide that comes out to the house to provide personal care, that's an example of a formal support.
Great. Thanks, Dana. Does the home care program provide home safety assessments?
So as part of the service, there is an evaluation for safety support needs within the home. So that is what's there. If someone's looking for, I don't want to speak to exactly what a home safety assessment is, because I think sometimes those are available through Medicare or through like a physician's office. Sometimes they'll do something like that. So they may be a little different. So I don't want to speak specifically, but there is a home evaluation to support the individual's needs within the home that the ASAP can provide, if that helps.
Great. Next question we got, what is a senior living advisor?
So a senior living advisor, they're actually pretty great. So they work free of charge and they can help you find a nursing home or an assisted living or other types of supportive housing for people who are ready to take that next step to have more supportive housing options. They do all that legwork for you and locating based on the area that you want to be in, the cost, all of that. And their services are completely free. I have worked with them in the past and had nothing but positive experiences and heard positive experiences. So if you're a very busy caregiver, which I'm assuming you are, it's a great resource.
A few more questions because I know we're coming close to time. This one just came in the chat. Does Mass Health perform background checks?
I can't speak to Mass Health specifically, but for our home care services, the vendors that we contract with, their employees have had background checks conducted. They've been Corey checked.
Yeah, thanks, Dana. I was just going to add that
Shannon.
Mass Health offers a lot of different programs, and some of them have vendor services, which are agencies, and then some have self-directed. So there's a lot of different programs within Mass Health to be able to give a one answer. But I would say if there's any questions, certainly they can reach out to Mass Health if they have whatever program they're in, if they have any certainly questions specifically.
Great. And actually, Shannon, that's the perfect segue to the last question we have time for, which is, are there any other programs or services that are that you would recommend caregivers look into that are part of Mass Health for their loved one?
Sure. So we actually touched just a little bit upon this. There is the Personal Care Attendant Program, which is a self-directed program for an individual who needs care in the home. Maybe they need help with bathing, but they're not comfortable having someone from a vendor come out. They have a family member that they'd rather do it, and they'd rather have that family member be paid to provide that care. The PCA program provides an hourly wage to the caregivers. There is the adult family caregiver plan for individuals needing care who live with a friend or a family member, and that friend or family member is paid a daily stipend to provide care. It is a tax-free stipend, which is also pretty great. Both of those are Mass Health programs. And then there's also kind of a supplement onto the home care program called Senior Care Options, of which there are 6 across the state, and they are connected to various health networks like Cambridge Health Alliance or Mass General. So depending on where you get your care, you might be eligible for one of those. And you can access home care services through that program, since those Senior Care Option programs contract with the home care department. And you also get the added benefit of additional medical oversight. So a nurse practitioner can come out to the home, they can do tests in the home or give like vaccinations. And you also have access potentially to like vision and dental service. So some enhanced medical care that might not be offered through Medicare or Medicare Advantage plans. And if you're looking for more information on any of those programs or anything that we talked about today, reaching out to the information referral department at your local ASAP is the best place to start. They can tell you which programs cover your area, get you connected, give you all the information that you need to make an informed decision about what's best for you and the person you're providing care for.
Perfect. Okay, I think that's a great note to end on. Thank you both for all of this information. Thank you everyone for joining. I put our email address in the chat, masscaregiver@mass.gov. If any of you have questions, comments, feedback on today's webinar, recommendations for future topics, would love to hear from you. And like Dana and Shannon said, your first stop should always be Mass Options. You will be pointed to your local ASAP, your local ILC, and all of this wonderful information and supports and services that were spoken about today. So thank you for joining. If you registered, you'll get an email about our next webinar. And yeah, thank you for taking the time today. Bye-bye.